Welcome, everybody. Wednesday night. I've got you all on mute, so we don't hear any background noises. But feel free to listen in, of course. This will take about an hour. And if you have questions, put them in the chat, and we'll get to those as well. Right now, we're just waiting for a few more folks, and then we'll get started.
This is the Medicare.
I hear you. Go, go ahead and mute if you can. Perfect. Yeah, we still have more coming in, so I'm just going to wait a little bit and then we'll get started here. Okay, slowed down. Let's get going. Oh, there's one more. And there may be a few more, but let's get started. Maybe not. I'll give them another minute. Okay, folks, slow down. Let's get going. So, welcome. This is another fun Medicare year. I thought last year was kind of a crazy one with disruption and changes, but I got to say this year might top it. And we're going to go through quite a bit, actually. And for all the questions, again, put them in the chat. We'll get to all those. And obviously, if we meet, we'll go through your particular questions and interests and what's going on with your situations. But there is a lot going on with uh, all of the people right now and all the carriers. Oh my gosh. So let's get to it. First slide here. You all know who we are. Sandy is the person that does all the work. I just get to talk to you all, so it's kind of fun for me. But we do have a lot of experience. We've got 10 years. We're on our 10th year with Medicare, believe it or not. And of course, we have over 30 years with Safeco and other agency companies that we worked with. Our base of people is based right here in Washington and northern Idaho. However, as we have quite a few snowbirds moving to Arizona, we decided to get licensed there. And then people started moving everywhere. And so we are actually in 13 states right now. And it's great helping people out. We're appointed with just about every carrier there is out there in our areas, and that's 30 plus carriers. They all have multiple plans, and we have to take tests on those every single year. So we just finished up with all of that, and open enrollment is just now starting. So one thing we're kind of proud of is the star ratings on Google. So thank you guys for sending in your recommendations on that. You won't believe how many people look at that first and then give us a call because we have one of the highest five-star levels out there for Medicare agents in Spokane. So thank you very much. Let's get here. Next one. All right. So our team grew a little bit this year. Last year we worked 14-hour days for 7 weeks straight, October, November, and into December. And we had one day off. It was Thanksgiving. And I got to tell you, it burned us out. So we got smart and we hired a gentleman by the name of Brandon Williams. Fantastic guy. And he's a licensed agent now, and he's right here in this office. So if you do come in, you'll probably see him. Also, Richard Sanchez down below there is one of our licensed agents. He has his own company, but he works through us. So he might be in the office from time to time. And then down here, you'll see two Santa's names. Our son Cameron lives in Santa Monica, California, just outside of LA there. And he decided to get into the business. So he started his own agency down there. And then Marissa, our daughter, is going to school and she's here part time after school and sometimes before school. So you'll see her around as well. So we have a good team, and it's tremendously helped. And I'm hoping I can take Sundays off and watch a little football this year. So we'll see. Just to share a little bit of our marketing for this year. Some of you probably saw us in the years past. We have been on TV with Nonstop Local at KHQ. We're on a lot of their news shows Monday through Friday. So we're also on their Today Show in the morning. And we got on the rotation for Jeopardy and Wheel of Fortune and Sunday mornings on the Today Show as well. So you will see us there. And it'll just be a little 15 to 20 second blurb, but it's kind of nice to get that recognition. We're also doing these client webinars. We're going to do some seminars as well. For the very first time here in the middle, we're going to do a billboard. Oh my gosh. So this thing is 14 by 48 feet and it's huge and it's right on Sprague. And as you're driving to Mullen, it's the street before Mullen, which is Willow. So you'll see it as you turn your head right. It's just past Jenny's Cafe and it's Medicare review time. So we want people to actually walk in and stop in and give us a call for an appointment, of course. Our website is huge for getting business for us, so that continues. And then we're doing quite a bit of Facebook ads and reels. So you'll be seeing a lot of our different 30-second and up to 3-minute videos on different topics. So anyway, that's what we're doing for advertising, besides keeping Brandon really busy. What we're going to do is kind of go through the different parts of original Medicare. We're going to look at Medicare Advantage. We're going to look at supplements, and then the big one, Part D, which is the drug plans, which is causing probably the most disruption of all the carriers here. So for original Medicare, Parts A and B, that's your red, white, and blue card. The Part B premium going up. The Part B deductible going up. Part A costs going up. And there is a new prior authorization model, not referral, new prior authorization model that's starting by CMS, and it starts January 1st of next year. And it's going to launch in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. So we are in that test pilot. It's going to go for 6 years, believe it or not. So I'll get into the whys here in just a bit, but we want to make you aware of that authorization. All right, get your pencils out. Here are the projected changes for next year. So the Part B premium, it's based on your income, right? And it can get higher as you make more income. But most people, if you make less than 218,000 jointly, you'll be at 185 a month, and that's what you've been paying this year. That is projected to go up 11%, so it'll be 206.50. And this is a projection from Kiplinger's and some of the financial institutions, and they're usually pretty close. Now, we'll find out the actual numbers in November and December of this year when they come out. The Part D premium going up a little bit. from 36 average to 38 dollars. That's a 6% increase. This is an average, and I think it's a misnomer because some of the plans were at zero last year, or this year, I should say, and some of them are going from zero to $85 in premium. The formularies are changing as well on all your drugs, the tier levels. So that has been a pretty big, interesting disruption for this whole thing coming up next year. So even though it says 36 to 38, some of them are at 85, a lot of them are at 50 for the premium. Some of the lower ones are at 20, 22. And, we'll help you out. We'll go through all of this. The Part A deductible, if you just had Part A and Part B original Medicare, uh, it's 1676 this year. The first time you're admitted to the hospital, it's going to 1716, so not really a big jump. Part B deductible is 257. Those of you on the G and N supplements, you have to pay that annually one time. It's going to 288, so that's a 12% increase. The Part D deductible, all the standalone drug plans are going up to 615, all of them. The Medicare Advantage plans that have a drug plan with them still will be lower. So they'll be in the two, three, maybe four, 500 range, but not up to the 615. So that's a better deal there if you went with the Medicare Advantage on the drug plans. Catastrophic level. So they instituted this last year, or excuse me, this year. My mind's in 2026. But for 2025, at the most you would pay for all of your medications on a drug plan, whether it's a standalone or whether it's Medicare Advantage, is $2,000 for the entire year. That works out to $167 a month, and you can put that on kind of a plan where it spreads it out monthly, making it a lot more affordable instead of having to pay huge amounts at the beginning. That is going up $100, so it's going to 2,100 for next year. This is actually a very good thing, putting this on a cap, because I got to tell you, there are a lot of people that have just one or two of those expensive drugs that are $400 or $500 a month, and you're hitting that limit immediately. So this really does help. So those are the numbers for next year that we're looking at. I wanted to show you the IRMA, which is the income related based amount that they look at. And this is how they raise the prices on your Part B premium. So right now you're looking at 185 for this year, and it's going to 206 next year. If you make these levels though, then it'll jump up to 259 to 289 next year. And then you can see the different levels and how much, if you make in those areas, you would be paying. So it's income related. They do a 2-year look back. So they'll look at your income. It is the government. So they'll look at your income from 2 years ago and decide how much you'll have to pay. And then they'll get this started for you in 2026. Now, what if you had a big income 2 years ago, because you sold a house or you got an inheritance or something like that. And then the next year it dropped back down, or you retired and it dropped back down. You can change it back to the current levels. And there's a way to appeal, and a high percentage of the time you'll get it appealed and go back down to the amounts you're at. So you can go back down to the lower amounts at whatever time. Just don't win the lottery because then you will be, well, that was marked. And then you will be automatically not caring because you've got more money than you need. All right, so that's the income related amounts for Part B going into 2026. Also, your Part D drugs premiums are affected by the income you make. They also go back 2 years. They only jump up like $14 to the next level, and then 28, and so on like that. But still, it's a lot of extra money that we have to pay. All right, let's look at this new prior authorization model. So we talked about the six states, and basically, you have to have certain services approved for treatment before you can get care. And their services are included that are included, but not limited to skin and tissue substitutes, electrical nerve stimulator implants, knee arthroscopy for knee osteoarthritis, and it excludes inpatient and emergency service, of course. But for some of these, we're kind of used to this on the Medicare Advantage plans, mainly because we've always had certain things that we needed to have approved before it was good. Now, remember, a referral is different. You get referred from your primary to a specialist. And most of the carriers do not require referrals anymore, but the specialists do. They're the ones that want a referral because they don't want a whole bunch of patients just coming to them that maybe really don't have the issues necessary for their services. So keep that in mind. Also, if you need a referral, everything's electronic now, and it shouldn't take very long, but I do know the hospitals, the doctors, the clinics, they're all so far behind because of lack of doctors and services and time, and everything takes a lot longer to get done now. These prior authorization rules are pretty common among Medicare Advantage plans, like we said. 99% are kind of used to them. So I think it won't be a too bad a thing. They call this program, it's being put on by the Wasteful and Inappropriate Service Reduction Program. Someone made up a fun name. They call it WISER. And again, it's going to run for 6 years, all the way up to December 31st of 2031. And I want you to read that yellow line there. Government data shows that 75% of Medicare Advantage denials are overturned upon appeal. That's tremendously high. So that's why they're putting this into effect, because some of the carriers are just automatically denying. And I have to say, from an agent standpoint, and having people call in with claim issues where they did receive denials, I've seen this. And it's kind of a rule of thumb for us agents to tell you go ahead and appeal again. And usually by the third time, they have decided to pay. So that's kind of a general rule going for now. Keep that in mind. But that's why they're doing this new prior authorization model to combat this. There was some growing scrutiny. One carrier, a big one, decided to cut 10% of its prior authorization requirements this year. And it's because they had a lawsuit alleging it used artificial intelligence to unfairly deny Medicare claims. Let me explain how this worked. Um, Sandy and I had this happen to us. Actually, it happened to her. Um, she went in for a routine physical, and all of a sudden, about a week later, she got notice that she was dying. And and we were like, "What? What's going on here?" And so we found out that from the doctor, who was very honest with us, that they had had AI take a look at it. And for whatever reason, because she was dehydrated, one of her test results came out low. And they pretty much said she had a disease that, she's going to die from. So, of course, a lot of tears and what are you talking about? And when he had to get back with a doctor. So this artificial intelligence is good, but it's way too early, and they really need to have doctors and real people look at what's going on versus having just AI determine and put in your chart something that's not right. So that's what's kind of going on in the world of technology with medical right now. So we won't. We're going to hear a lot more about prior authorization and how this all works too. So just wanted to share that. Other changes. Let's talk about supplements. They're going to have the same exact letters, plans. So the F, the G, and the N are still very, very popular. Um, there's no change in those in the coverage. However, there are going to be some huge rate increases. And one state happens to have what we call state portability. And a lot of you knew this already, but if you're on a supplement in Washington state, you do not have to answer 30 health questions and be denied if you answer yes to any of them when you want to change a carrier or a plan. You can move monthly, guaranteed issue in the state of Washington. So we're very fortunate to have that with us here. In other states, they do have to answer 30 health questions and they can deny them. And it happens all the time. It's called underwriting. And then in a few of the states, they've now moved to what they call the birthday rule. So in Idaho, Oregon, and California, within, depends on the state, within 30 to 60 days of your birthday, you do have that chance to move guaranteed issue. So it's a good thing for them. Let's take a look at this. Medicare supplement premiums in 2026 are expected to see increases, with some projecting rises in the 8 to 12% or higher rates. Normally in March and April, every carrier goes up 3 to 5%, and that's just normal. We've now seen some carriers take one, two, maybe even three increases during a year. There is one right now, if anyone's on an ACE supplement, it's a great company, but they're taking a 28% increase on December 1st. So, and that's just bringing them up to where the middle of all the G prices are, believe it or not. There is one carrier that we love, but they raised their prices to $320 a month for the G, and that is the highest right now in our area for Washington State. There are quite a few lower, and a few months ago, I sent out some emails to everyone on a supplement that we have showing that you can save a ton of money by moving to a different G with a different carrier. It's the same exact plan, nothing's different except for the price and the carrier name. So that's something you should all be taking a quick look at. I want to go over this just a little bit, what you can do when you have a supplement for 2026. Just understand the policy. You know that it doesn't cover dental, vision, or hearing on your supplement, but you can get that, and we can help you outside of Medicare. Shop around. Give us a call. We'll shop for you. We are licensed in what I said, 13 states and with every major carrier. So we can tell you the prices. And again, Washington State has portability. So we can really save you money any time of the year. You don't have to wait for open enrollment. Understand IRMA, your income related monthly adjustment amount, because that's going to affect your budgets. And plan for some budget increases because things are going to go higher, not only with your supplements, but with your Part D drug plans as well. So I wanted to show you this example. The most expensive G supplement is $320 a month. Okay, times 12. That's a lot of money, folks. $3,600 a year. The lowest G right now is 208, and the G is the same. It doesn't change going from carrier to carrier. The coverage is identical. So you could move from this to this, and you would save $112 a month times 12 per person. So annualized, you're saving $1,344 a year per person, and a couple can save $2,688. And after 10 years, folks, you're talking real money here. 26,000, and you're still on the same good coverage plan. So this is some real savings. You can move every month of the year here in Washington State. So if March and April come around and you start seeing your plan going sky high, give us a call. We can move you the very next month, and we lock you in for 12 months at that same low rate. So this is a way we can really help you, and I just wanted you to all know about this because a lot of people forget and they think they've got to be underwritten and answer all those questions, and they might be denied. You won't in Washington State. Okay. All right. Let's talk about Medicare Advantage. What are some of the changes here? Huge changes. Decreased commissions. That's us, folks. They're telling us they're not going to pay us for doing certain things. Decreased Medicare Advantage plans. There'll be less plans. All the carriers are condensing from 10 plans down to maybe three or four at the most. Decreased benefits. We already saw that this year. Some plans didn't have dental. Some plans only had preventive. Some plans didn't have hearing. I mean, it's just quite the mix. So we had to really analyze things for you and get you all on plans that really fit your needs. So I want to talk about the commissions first, because this, of course, affects every single agent in the United States. Right now, how do I say this? In the last 2 years, the Center for Medicare and Medicare Services pays the carriers. And I think I've told most of you this. If you're on a Medicare Advantage plan, CMS will pay that carrier approximately $10,000 a year. They fund them. That's how they can keep the premiums down to zero and all those benefits being paid for. And in the past years, it's worked fine. Well, in the last 2 years, the funding from CMS has gone drastically down. So all these carriers are really financially struggling. You might remember my distress video from last year. Four carriers had to leave our state. Primera was one of them because they financially couldn't make it in the Medicare Advantage business. This is happening across the whole United States. So it is a pretty traumatic time right now for the carriers. Now there's still huge carriers and they're going to weather the storm. So what you're seeing is a kind of a consolidation at the top where the big carriers are continuing, the little local ones are disappearing. Networks of doctors and providers, you all know how hard it is to go see a doctor right now. And if you're brand new and have a brand new doctor for Medicare and you got a new plan, I've heard it's taken up to 6 to 8 months just to get in to see them the first time. After that, you're good. You can be on a regular schedule, but it's getting pretty tough out there for the medical field, and they're trying their best to remain solvent, and they will. The big ones, I have no problems. They're going to be just fine. Us as agents, we have been told we're not going to be paid commissions on certain plans, which makes it even more harder. And I've come to the point that I don't care if it's the right plan for you. That's what we're going to put you on. We have been doing really well for the last 10 years, thanks to all of you. So we're going to stick with that and we're going to weather the storm as well. We may lose some commissions here and there, but that's okay. We're not going to move you just to make a commission. We want you on the best plan for you. So that's kind of what's going on with agents. And you'll probably hear, if you ever did talk with another agent, they're going to want to move you to something that they get paid on, and it might not be the best thing for you. All right. So unexpected medical costs are causing these financial pressures on the carriers, lower medical payments or Medicare payments from CMS. And believe it or not, people are using their medical health a lot more. So there's a lot higher underwriting losses. And the cost of doing things is so much more. So these things are all affecting and putting the pressures on the carriers. So what are the carriers doing? They're scaling back operations. They're closing plans. They're exiting certain geographic areas to reduce losses. The cuts and exits are strategic moves to recover flagging margins and focus more on profitable parts of the market. Some insurers are reducing benefits, creating higher deductibles, and narrowing provider networks in their remaining plans to manage the costs. So I want to share what, I'm going to go back to that, sorry. I want to share what the local area is doing. So in Washington State, there we have two main doctor clinics. We have Providence and we have Multicare, and of course a lot of other smaller doctor clinics, right? Most plans, Medicare Advantage plans, worked with both Providence and Multicare. Some just worked with one or the other, but most worked with both. Now that's getting smaller and smaller. Multicare has made the decision and announced to us that they are not going to take any Humana plans, whether it's a supplement or a Medicare Advantage plan. They're not taking any Humana plans. If you're on a Humana plan and you have a multi-care doctor, or you want to see a multi-care doctor, we need to see you and get you moved to a plan that will work with them. Multi-care also will not take any PPO plans. They weren't making money with them. So a PPO is a preferred provider organization type plan versus an HMO type plan. HMO plans are ones that um, you have to go to their network of doctors, which is great because they have good prices and it really helps keep things down. A PPO lets you go to the network doctors, but also gives you that out to go to a specialist that's maybe outside of the network. It'll cost you a little more, but the policy does allow for that. So they're not making any money on those PPOs. So you now pretty much need to consider moving back to an HMO. Well, in a lot of the rural areas, middle of Washington, north of Spokane here, there aren't options. And so PPOs are kind of the main options there because of the smaller doctor networks. So this has been a huge conundrum for us. People still can go on a supplement, and there's some other methods we can do too, and look at just what's best for you in your area. So get with us and get an appointment. We're booking up really fast right now. So give us a call. Sandy will get you booked in. We can do phone calls, Zooms, and in office if you want. Not a problem. So that's kind of what's going on right now. It's really hard for us as agents because we're used to taking your needs and okay, let's take your meds. We're going to put them in the software we have, and it'll tell us the prices on every single plan out there. It'll tell us which pharmacy is the best one to go to for your drugs. Maybe we do a few of your drugs up in Canada because it's financially better, et cetera, et cetera. Now we have to really figure out which plans have the benefits you want, which plans are going to be best for you, and kind of work with you on that. So, anyway, very challenging this year. Very, very challenging. All right. Now I'm going to move on to Medicare Part D. Um, this is very interesting. So I mentioned commissions. Some of the Medicare Advantage plans, of course, the PPOs, we're not going to get paid a commission on, but if it's right for you, we're going to put you on it. Medicare Part D, there's 12 different plans out there, standalone drug plans. Only one's paying a commission. So again, whichever one is best, we're going to put you on. Okay. On of these, the premiums went sky high, as I might have mentioned earlier. One carrier went from $0 to $85 in premium a month. The out-of-pocket cap increase went to 2,100, so it's only $100 more, and that's actually a good thing to have. Deductibles increased to 615. We're going to talk a little bit about insulin vaccines. Right now, they're really low and free. Drug price negotiation is finally happening. We never, or Medicare never had the chance to negotiate prices with the pharmaceuticals. They just named their price. And we all know some of those prices were gigantically huge, and it isn't all research and everything. So anyway, there's another thing we'll talk about. We looked into this to help people on very expensive medications, and we found a place here called the Canadian Med Store that can help dramatically. So let's talk about all this. So we talked about the premiums for Part B going to 206 probably. We talked about Part D premiums going up, and it really depends on the plan. I think Humana has a plan for $22. Most of the plans are, like I mentioned, in the $40 to $50 range, and one of them's up to 85. That's a lot of money for a drug plan. Let's see, let me go down here. Yeah, we talked about all that. Okay. Inflation Reduction Act. This, was passed quite a few years ago, and last year was the biggest change of everything. And so the threshold for all your drugs went to $2,000 this year in 2025, going to 2,100 next year. So think about that. The most you'll pay for all your drugs is 2,100 next year. And if you divide by 12 months, it's about 170-ish, which is not bad if you have some really expensive medications. So I think this is a really good thing. The problem is, in the past, there was only about 5, maybe 10% of the people that hit this threshold because a lot of people weren't taking many medications or they were taking generics, etc. Now, that 5 to 10% is going to grow dramatically as the formularies have changed on all the costs for your drugs, the different tiers on all the plans, and the premiums have gone up and the deductibles have gone up. It's going to be very much easier to hit that threshold. So the pharmaceuticals were losing money by this. However, now they're going to have more people hit it. So they're going to get back their profits. Insulins. You might remember just a few years back, insulins cost $500 a month. They were very expensive, and a lot of people are on diabetic insulins. They made the brand names, not the generics, but the brand names capped at $35 a month, which was fantastic. So when we run your drugs and we find all the different plans, most of them are at $35. However, you might even pay less than that. So starting in January 26, you'll have one of the lesser of these three things, the cap at 35 or 25% of the maximum fair price established for the covered insulin if it's negotiated by Medicare, or 25% of the negotiated price if it's on a PDP plan or an MA plan with drug coverage. So whatever it works out, you're going to pay at the most $35 for your insulin, which is fantastic, and even less. So that's a really good thing. Vaccines. We're still eligible for the free vaccines. So COVID, flu shots, shingle shots are all free right now, although these may be harder to come by. Here's why. There's an advisory committee for immunization practices group called the ACIP, and this rule for eliminating the deductibles and copays for vaccines will still stay in place. However, there is uncertainty as to whether the current list, which includes COVID, shingles, it will change. In June, U.S. Secretary of Health and Human Services and noted vaccine skeptic, Mr. Robert F. Kennedy Jr., he removed all 17 members of the ACIP. And by doing that and putting in people he wanted in there, there's a lot of hostility, and we don't know if there's going to be shortages and difficulty getting these things. So with all of this going on, just be aware that vaccines may change in the future. And I definitely don't want to get political one way or the other, but it's going to be a little harder, I think, to get these vaccines. But at least they're free now. Shingle shots, that type of thing. Gosh, they used to be $200 a shot, so that's great. Also, part of the Inflation Adjustment Act let Medicare negotiate prices on some of the more expensive drugs. So next year, these 10 drugs are going to be negotiated. Eliquis, Enbrel, Entresto, Farxiga, Imbruvica, Januvia, Jardiance, Novolog, Stelara, and Xarelto. And I think they said in 2027 they're going to be looking at 15 drugs, including all the weight loss and diabetic drugs, the Ozempic, Ribelius, and Wegovy. Now, I have worked with a company called Canadian Med Store, and they have facilities up in Canada, of course, but they also have them in the United States. And you can't quite read this because it's so small, but um, if you are on any of these, Eliquis, Xarelto, Farxiga, Pradaxa, just going down Ventolin, Spirova, Janumet, Januvia, they can get this for $50 a month. And what they do is they get it wholesale from international countries. And they are under, I think it's called the Spira model, which Canada uses to educate and make sure that pharmaceutical companies are giving out quality meds. And so it looks like it's a really good situation. If you were to buy if you were on a Medicare plan, you got a portion or a drug or two in Canada, that's outside of your plan. So it doesn't affect if you had a tier 3, 4, or 5 medication, which triggers a deductible of $615. So for some people, what we've done is find a better location to buy and cheaper location to buy their drugs. And then some of them they still get in on their plan, but the big ones maybe they get from Canada. And this would save you from paying a deductible and also get you a nice lower cost. So we might recommend you get in touch with these people, and you'll give them our name so that they know that you're with us, and they may be able to help you and ship this information or these drugs for you. They have over 2,000 medications that they can get internationally and at wholesale costs. And we all know in the United States, the meds cost about 5 times as much as anywhere else in the world. And it's because we can pay for it, right? But it's still very expensive for us. And if we can get the same drug from the same company a little less expensive, that would be good for us too. So just be aware of this and ask me if you have any questions on it. And if you do have any of these meds, we might suggest checking into it, see if it works for you. We're always looking for ways to help you get the medication on time and save you money. All right, another fun area. I have not really used ancillary products very much in the past, but I think this is a great time to do it. So I'm going to give you just a quick run through of cancer lump sum policies, hospital indemnity gap plans, of course, dental vision hearing if you need it with a supplement because you have to get it outside of that, and final expense. This is a really good time to be looking at all this. And I want to talk about cancer first. A lot of you may have heard my story. I had a sister who died at 52 of cancer. She fought it for 4 years and tried every single chemo there was, and some of them were terrible. I wish she would have had one of these lump sum policies because you pay a small amount every month, and then if you are diagnosed with cancer, you get a lump sum payment automatically. And for her, there's so many expenses. They say it's upwards of 54% of all your costs on cancer. 54% are outside of what a plan pays for. So, yeah, they'll pay for the medical and the surgery and that type of thing if needed. But the travel to go see expert doctors. My sister went to the UW to see specialists. She went to France because at the time, France and Germany would take out the white blood cells and put in a cancer fighting thing for her specific cancer and put the white blood cells back in, and it actually worked. Um, but then it came back with a vengeance and took over her whole body. It wasn't localized anymore, so she didn't have a chance. But they have perfected that now, and it is approved in the United States. So these type of things, the travel, the wigs, the costs, maybe just worrying about paying your own bills. You get this lump sum of money, and it really can help with the stress. Most common types of cancer over here on the left. For women, it's breast at 32%. For men, it's prostate, 29%. One in every two men get cancer. One of every three women get cancer on average. That's 4 in 10 Americans. 40% will get it. So if you have it in your genealogy or for whatever reason you're worried about it, we can help you with a lump sum cancer policy. I want to show you this real quick. We work with a lot of different carriers. This one's just Bankers Fidelity, just to show you a price. You could get a $5,000 lump sum cancer policy for $11. That's a latte and a tip. So I wish this was available when my sister was. And we can change this to up to 75,000, anywhere from 3,000 to 75,000, and it'll just change the amount. But gosh, that's inexpensive for a lump sum cancer. I would recommend if you're on a supplement or a Medicare Advantage, getting that done. Again, 18 to 99 is the issue age. Oh, I guess it's 5,000 to 75,000. It's guaranteed renewable. You just get a lump sum, and you can continue even though you've been paid on one. You can, if it comes back, you can do it again. And it's not just for you. It can be, or Medicare age folks. It could be your family members as well. So this is a great, great additional plan for a very small amount of money. The next thing I want to talk to you about is the hospital indemnity. If you're on a Medicare Advantage plan, there are gaps. You have to pay deductibles and co-pays and co-insurance on a lot of different things, right? If you're healthy, you're not going to use them, and that's why Advantage plan is great, because you're paying a $0 premium, and you're only going to pay when something happens. Well, with hospital indemnity plans, it can pick up those deductibles and co-pays and co-insurance. So what's the biggest expense on a Medicare Advantage plan? Hospital inpatient pay. And these are running about $450. You're going to see some at $500 next year per day, up to 4 or 5 days. And that's if you're in the hospital that long. If you're in the hospital just for a day, it's only the 4 or 500. But we can do an indemnity plan that will cover that for a lot less money. So you don't have to worry about paying $2,000 payment if you go in the hospital for the next year. And it also has emergency room copays and ambulance copays and actually quite a few others. So for a small amount, you can get that all covered and not worried about those big expenses that might hit you. Now, the Medicare Advantage plan is great, and it does have what we call a maximum out of pocket. And those are usually in the $5,000 to $6,000 range. But most of the time, 95% of the time, you're never going to hit that because you've got this inpatient coverage at $2,000. So I'm going to show you an example of that one after we look at this. Let's see here. Benefits are paid directly to you. It's guaranteed renewable for life, 30-day look. You can use the money to pay for anything, not just medical. It's a lump sum payment. So it's really a good deal. 50% of Americans carry medical debt. And an average stay in the hospital for 3 days is about 30,000. Now, your inpatient coverage on your Medicare Advantage plan is going to pay for everything except for about 2,000 of it. So this is a good thing. And getting this on top of it will take care of that 2,000. So here's just a quick example, again from Bankers. But I've got your hospital admission covered, 300 bucks. Your daily inpatient coverage, I just put 300 bucks a day for 5 days as an example. That's $1,500 max. Your emergency room. A lot of hospitals do the observation thing where they say you're not admitted yet, and they charge you for observation till they finally admit you. You could have ambulance air coverage, ambulance ground coverage, and urgent care. And for all of those copays, it'd be $24 a month. Extremely reasonable. Again, uh, take a look at these lump sum cancer and the hospital indemnity. If you're on a Medicare Advantage plan, this is really something to strongly consider. The next thing, dental vision hearing. If you're on a supplement, you don't get coverage for it with the supplement. You have to buy it outside. So we've always referred people, and we can do this for you, of course. We're appointed with Delta Dental. Just about every dentist in our area takes Delta. They're very good. They've gotten a little pricey. So we searched and we found another company called Emeritus. A lot of you are on this one. The prices on this are about half. It's about 60 bucks a month. Yeah, a month per person for the $2,000 coverage on Delta. Emeritus is at $29.95, so half price. On a Delta Dental, you have a 12-month waiting period before the comprehensive crowns and the canals take effect and have coverage. On Emeritus, it's 6 months. Other than that, they're just about the same exact type of plan. Emeritus is nationwide as well, and believe it or not, there's over 800 dentists in Spokane County that are contracted with Emeritus. At first, when I heard there was 800 dentists in Spokane, I was like, I'm in the wrong business. I was shocked. So yeah, very, very good company. Also can get riders on your Medicare Advantage plan. So Humana, United Healthcare, Providence, Aetna, they all have those dental riders, but they're in the 60 to 70 to $80 a month range. So it's much better to go outside and get Emeritus or Delta Dental. And a lot of policies next year, Medicare Advantage, will only cover preventive, not the comprehensive. So you now need to look at that as well. If any of you do periodontal and have before visits for the really deep cleaning, your plan will cover two of those with Medicare, but then you have to pay for the other two, which are expensive. You could get on Emeritus or Delta Dental and have that covered because they give you the two free preventives as well. So a lot of people double up like that. And again, it's 29 or 30 bucks a month for the 2000 plan. It's only 25 bucks for $1,000 plan. So very, very good. Now in Idaho, Emeritus has a different name for their plan there, and so does Delta Dental. And it's a little more costly because there's less population, but we can help you with that in Idaho and Oregon too. All right, final expense. Usually we kind of promote this in January after the holidays and everything, and things settle down, but I wanted to show this to you. My dad died over 10 years ago, and my mother died a couple of years ago. And it was heartbreaking, of course, but when you go to the funeral home and you start seeing the prices of things, I was just shocked, just shocked. Um, a burial versus cremation, there is some savings, but oh my gosh, the plot, the headstone, the service, the flowers, the everything, it's so expensive. Fortunately, my mom, bless her heart, was very proactive, and she put down what she wanted and worked with the Heritage Foundation out there on uh, by SFCC and built a plan. And she had everything down, and she's been paying for this pretty much in their senior life every month. And so for us kids, we have four in our family. The only decision we had to make was picking the flowers. And I got to tell you, that was fantastic. So Sandy and I went there and we started looking at prices and again, we're totally shocked. But it is a good time to consider doing that. I kind of like this, leave memories, not bills, um, because it is super expensive. So what final expense does, again, it's just an insurance product that gives you a lump sum if you pass. And your family can use it for whatever they want, paying bills, paying funeral expenses, you name it. So it works kind of like this. You can pay for the vault, cemetery, monument, traveling, meals, catering for guests, final medical bills, legal fees, credit card bills, other estate costs. You can use it for whatever you want. And it is overwhelming with grief when you're going through this, so especially for a loved one. So the issue ages on this particular plan is 45 to 75 years old. You can choose any amount between 3 and 50. If you're 76 to 85, it's 3 and 35. So pretty much you can go all the way to 85 and get something. Funeral costs in 2021, the average nationwide was $7,800. I can tell you they were well over 10 to 12 grand when we went in just a few years ago. So it's very, very expensive. And they have all kinds of different writers that we can add as well if you want. But here's what a price would be for a $5,000 lump sum. No, it's not the 7 or 10 that I was talking about, but for 5 grand, it's 36 bucks. So again, very, very reasonable. If you doubled that, I think it for 10 grand it was 68, even though that would be 72. It's 68 bucks for 10 grand. Um, so it just depends on what you need. If you just need a small amount to cover things right now, this is fantastic and will help out your family. If you're looking for something like this, get with us. So again, lump sum, cancer, hospital indemnity, life products, and the dental and vision and hearing we can help you with. And anytime during the year we'll help you. All right, key time periods next year and this year. All the acronyms in insurance. Annual enrollment period is AEP. MAOP is Medicare Advantage, open enrollment period, and then supplements, which is Medicare, Medigap enrollment. They're all different. So October 1st, every year, we can talk about the changes. We get all this information after all our testing, and all the carriers will now do their presentations to us and show what their plans are for next year. But we cannot sign anybody up until October 15th, which is next week. So that's why we send out our annual letter. We ask you if you want to have things reviewed. We will now take your meds, put them in our software, like I said, find out the best MAPD plan for you, Medicare Advantage with a prescription drug plan or a strict prescription drug plan by itself on your meds. And then we'll pick out a supplement with that, or we'll help you pick out a Medicare Advantage plan that goes with it. And we can then send you up on October 15th through December 7th. And these are effective for January 1st. So you're still going to be on your policy until then. And it works out just smooth. This is our busiest time of year. Medicare Advantage open enrollment. Every January, February, and March now, you have a one-time shot if you're on a Medicare Advantage to drop it and go to another Medicare Advantage. Sometimes you got a new medication that just came up. Sometimes your doctor just moved. For whatever the reason, you can move to another plan. And we are super busy during this time for sure, because a lot of people are figuring out, oh, my plan isn't paying for what I thought. I didn't go to an agent, didn't go to Mark, and I should have. So this is very important. Supplements. Supplements, you can sign up when you're 65 for a supplement and or when you get your Part B effective date. You have to be over 65 though. So If you are an employed person and you're on employer benefits and you deferred getting Part B, when you finally retire and sign up for Part B, you now have 6 months to sign up for a supplement and you'll be guaranteed issue. They won't look at any prior history. Once you're past that 6 months, then they're going to go ahead and underwrite you, and that's where the 30 questions come in. And you can be denied, except in Washington State, they're guaranteed every month. And there are birthday rules for Idaho, Oregon, and California, and some of the other states as well. Now, there's also what we call special election periods. So if you moved from one state to another or a county to another, then you have a certain time period. It's usually 60 days to move to a new plan. We have a couple that we've had for a long, long time, and they just moved to Florida. And so we got licensed there. So that's why we're in 13 states now, 12 now, and we're going to help them out in Florida. So, and they promised to invite me down and see their pool. So I'm kind of excited. Uh, all right. Getting back to us again, 5-star reviews. We really appreciate all of your business. If you have any friends that are trying to do this themselves or really need some help, please have them call us. That's why we're here. Sandy and I have been doing this now in our 10th year. We just love helping people. We got out of the fun life in the political world of corporate, which was great, but and we met some fantastic people there. But now we're kind of an independent business, and we just love what we do, helping you. So there's our phone number. Have people call us. There's our website. You can do a little QR code. And I'm going to open it up. If anyone wants to turn off their mute and ask a question, let me know. Anybody out there? I'm going to go to the chat. Let's see. What about Oregon? Are we affected by prior authorization? No, it's only those 6 states. Does the prior authorization, move that, apply to G plans? Yeah, it's not just the plans, it applies to the medical facilities and all plans. So yes, applies to G. What is CMS? It's the Center for Medicaid and Medicare Services. That's the giant corporate government entity that oversees all Medicare. And you've heard the names Mehmet Oz, and you've heard the names of Mr. Kennedy, and they're kind of running the show there. And so that's what's going on with CMS. Government, well, they're kind of in their own government entity, but that's the guiding principle is these guys. And then they set the tone. CMS gives us tests, and all the carriers tests every year on everything. So we're always up to date. And it looks like that was all the questions.
Mark,
Yes. Hi, Marilyn.
Marilyn here. Hey, yeah, I'm traveling. I'm talking to you from where am I? Uh, Massachusetts. That's where I am right
Ah,
now. But I'm just traveling. It'll be a couple more weeks till I'm back in town. But you know, because last year we had what 4 companies that stopped having Medicare Advantage, and
yep,
so you had me go on United, and
yep.
I've not been super thrilled with them in the sense of I expected it to basically be the same as Primera, but for example, when I go for the dental, there's extra 65 or $70 that I didn't used to have to pay with the previous. And then
Mm,
with the eyes, I went to go get a prescription and I had to pay also a 65 or 70. One was 65, another was 70 with the eye and the um, because I was wanting a prescription. I'm going like, well, you get your eyes tested. That had just been with it for free, or
mm,
not. There was no additional charge with Primera. So I was, but yeah, and so they also with dental, they just do preventative. My dental office mentioned. So
yep.
is there any Medicare Advantage plan that's better than they?
Yes. So United Healthcare has three or four plans now for next year. One of them has dental for $1,500 and gives you the preventive. All the others have just preventive, and I'll bet you're on one of those. So you're having to pay when the other plan would have picked it up for you. So let's get together when you get back and let's take a look and see if that's a good move for you. Okay.
Because I asked them who take, like, they deal with a lot of different people. So I asked them which insurance covered the best. And so I left that piece of paper at home,
Yeah.
but they gave me several of ideas. So you might know some of those too.
Yeah. The plan I'm thinking of with United Healthcare that might be good for you is the Washington 15 plan. And it does have the $1,500 on it. And it lets you go to any dentist. A lot of the plans you have to go to their network of dentists, but this particular one lets you go to any dentist. And if you go to one out of their network, they'll reimburse you. So it's a good deal. And we can
This is
look
a
at and we can look at Delta and Ameritas as well.
Okay.
Yep. Are you
Alrighty.
enjoying the fall colors back there?
That's the idea. My goal is to yes, go all along. I was, gone across the top and then going along the eastern, heading Rhode Island tomorrow. So
Fantastic.
yes, enjoying
We're actually having good weather right now here in Spokane, so we're enjoying it
Yes.
too. Well, very good.
Yes.
Thank you very much.
You bet. Thank you.
Anybody else have a question?
Hey, Mark, this is Kim.
Hey, buddy.
Uh, the Canadian Med Plan, how big a hassle is it? You get a prescription from your doctor and they send it direct, or do we have to get a copy and then we send it, or is it?
It's even simpler than that. They're going to call you and walk you through everything, and they'll contact the doctor. They'll do everything. So it's like talking to me, but you're talking to them, and they'll get everything set. One thing they did mention to me, Kim, is they like to work because it's international. There's a time lag of getting things, so they want to make sure you're getting a 90-day supply, and it takes almost 30 days to do that. So if people are looking at January 1st as a start and maybe going on this or working with them for it, you want to do that in November and at least a month ahead so that you get it timely done or you stock up on your meds before the end of the year.
The current plans for I use that Eliquis anticoagulant, and they hit you with a this year they hit me with like a $400 or $500 bill for the first 90 days, and then it's 125 for the next three sets of 90 days. It seems like this would be save me a few $100s,
I think it will dramatically. Yeah.
and it's not a hassle. Okay, that's all.
Not
Thanks.
a hassle. Yep.
Okay.
Thanks. Hi, Mary Kay.
I
Anybody else have a question? All right. I get to go home in the dark. This is the first time I'm going home in the dark, guys. So here we go. I hope this helped and gave you some new information. Was that somebody?
Hey,
Hi,
Mark,
Mark.
can you read the
I,
chat? There's a couple
I,
of chat.
yeah, I wrote something in the chat, I think. I'm sorry, I came in at the very end.
It's okay. Hi,
And
Peg.
hi, and you are recording it, correct? So I could go back.
Yes.
All right.
Yes.
And what was my question I typed in? Oh, you sent something about handing in to you medications by September 27th, and I passed that deadline.
It's
So,
okay.
okay.
Yeah.
So is there a form to fill out or do I just call you?
We decided not to do forms this year. They got too cumbersome. So just send us an email or call us and
Okay.
give us your meds over the phone or on an email and we can run them for you.
What about supplements? I don't have medications. I just take supplements.
Yeah, some of the plans have what we call over-the-counter money, and you can get a certain stipend for every 3 months, and you can buy your supplements with that, which is great.
Oh, well, okay. So I should have those on hand when I call you, what I take.
Yep.
Okay,
Yep. The name, the milligrams for each one, and how many you take a day.
name,
And
milligrams,
how many
and
you
how
take a
much?
day. And then we also like to know all the doctors you're seeing, especially your
Okay,
primary, but any specialist as well, so that we get the right network for you.
okay, sounds
Okay.
good.
Very
All
good.
right, you're
Thanks,
great.
Peg.
You're welcome. Thank you.
Let's see. Here's another question. Hi, Mark. Can you tell us what the relationship is between United Healthcare and Optum in Arizona? Optum actually is a part of United Healthcare, but I've got to research because there might be a second business called Optum that's not. But United Healthcare uses Optum as their mail order for their drugs, and you'll hear that name quite a bit with their company. But I'll check into that a little further. Was it specific to meds or plans or just in general? That was JD.
Yeah, this is just in regards to insurance processing, claims handling.
Oh, okay. Yes, they did hire a company called Optum to do some of the claims handling for they are the largest company out there, you know that, and nationwide. So volumes and volumes of things. They've been in the news a lot lately, but I got to tell you, they're still a very fine company. And I worked for a fairly large company. Kim and I did, and it was bought by Liberty Mutual, those emu commercials, and we were used to handling or dealing with all that. But United Healthcare, I got to tell you, they're so big, and they still do things very well. Now they've been in the news for a lot of problems lately, and their CEO as well, getting shot, believe it or not. So that's the industry we're working with now, and it's unbelievable all these things are going on in the United States. So,
Well,
um,
Mark, appreciate that we've just had some real challenges with that processing between United Healthcare and Optum. So we just wanted to be sure that we kind of called that out with you guys and make sure everyone's aware that there seems to be a disconnect somewhere with claim processing where Optum took it over in April and is processing everything from April forward. And there's problems getting stuff processed from March back to January.
so it's a timing issue.
Yeah, they just handed off the responsibility. They transferred the April 1st claims processing from within United Healthcare to Optum as a service.
Okay. If you have any time issue, any problems with claims, you can call us. We have a lot of clout with United Healthcare because we do pretty good business with them, and we can get to the right people to get it done more quickly. So get with
Perfect.
us. Yep.
Right, give you a call offline. Thank you.
Great. Thanks, JD. All right, guys. I think that's it. So October 15th is when we start. We've already got bookings for about a month. A few openings in between, but we're just getting booked again. But we have a new licensed guy here that's going to let me go home and watch some football on Sundays. So we're excited. And other than that, call us if you have any questions. Love to have each of you send a referral or two like you've done in the past and send some friends over. So thank you very much, and I appreciate your time tonight.
Thanks, Mark.
Thank you.
You
Bye.
bet.
Good
Bye-bye.
night.
Bye.
Thank you.
Bye-bye.
Okay.
Oh, how do we get your recording?
I'm going to post it on our website. Good question, Peg.
Oh, okay.
And I'll shoot you an email.
Okay, great. Thank
You bet.
you.
Bye-bye.
Bye.